Hi, my name is Claudia. I'm an FSCJ nursing student, and today I'm going to be demonstrating NG insertion and irrigation. Okay, so I've gathered all of my supplies right here, okay, and the first thing I want to do, though, is to check my MAR against the doctor's orders, which I'm doing that to make sure that I have the correct name, date, the procedure that I'm doing, the NG with irrigation, the size of the tubing, and that is 14 French, 48 inches. The reason for this procedure, which is for suctioning, I want to make sure that known allergies are the same and that any pertinent labs are also the same between these two items, and they are. So now I can go ahead and proceed to the patient's room. All of my equipment, as I said, is here. It is intact and it is up to date. All right, so I'm going to go ahead and knock. Hi, my name is Claudia. I'm a nursing student, and I'm going to be doing an NG insertion and irrigation for you today. Can you tell me your first and last name? And I'm going to check to make sure that's the same on his wristband, and it is. Tom Jones. And what is your date of birth? October 1st, 1960. Okay, very good. Also is the name on my MAR, so I can proceed now. Mr. Jones, do you have any known allergies? No? Okay. And have you had NG tube insertion before? No? Well, basically what it is, it's a tube we're going to be placing down your nose and into your stomach. It's being done for suctioning, and I want you to let me know at any point if you're uncomfortable, and we can stop and I'll let you rest, okay? Alrighty, so at this point I'm going to go ahead and wash my hands. I'm going to have the patient blow out of his nose, and as he does that, I'm going to occlude each nostril or nair, make sure that he has patency, and I want to work with the one that has the most patency, and I think this left one is a little clearer, so I'll probably use that one. I'm going to take my pen out though, and I want to check and make sure there's no deviated septum, no bleeding, the oral cavity looks intact. Okay, everything looks fine here. So the next thing I'm going to do is go ahead and take this towel. I'm going to put it at his shoulders, keep from getting him wet. And I'm going to put the basin in the lap in case he needs to spit later on. All right, so now I'm going to go ahead and wash my hands. I'm going to take my tubing, and I want to measure it. And I'm going to measure this from the tip of his nose to the tip of his ear and down to the xiphoid process. And that's 57 inches. So this is actually marked, but if it wasn't, I'd go ahead and take a piece of tape to mark it or a marker. All right, so I'm going to go ahead and put this here, and I'm going to just wash my hands again and put on my gloves. Okay. All right, so now I'm going to take my tubing and I'm going to lubricate it, about 4 inches of it. And I'm going to begin to slowly insert into his left nair. All right, I'm going to tilt your head back, Mr. Jones. All right, I'm going to slowly do this. Okay. All right. I feel a little resistance. I'm going to check for any coiling in the back of the pharynx here. And that looks good. Okay. I'm going to proceed a little more. All right, I'm going to give you a sip of water and make this a little easier for you, Mr. Jones. Sip some water. Okay, swallow, swallow. All right, okay, more percussion. Okay, I'm going to tilt your head forward now. Okay, so let's say that my tubing is completely in. I have the whole 57 inches in at this point, or centimeters. I'm going to go ahead and temporarily just tape this here, and I've already pre-made some strips of tape here. Okay. All right, so what I want to do, let's say that stays in place. We'll try adding one more piece of tape here. Okay, what I want to do is check for the contents for placement of the tubing. So I go ahead and insert my syringe, and I'm just going to pull out. Okay, looks like I have some contents here, and I would want to observe the color and the consistency of the gastric contents I've pulled out. And the next thing I'd want to do is take my stethoscope, and I'm going to listen for a swishing sound as I re-inject this back. I'm going to place my stethoscope over the epigastric area here on the left side. Okay, and I do hear the swishing sound, so that's good. So we apparently have placement there. Now for absolute confirmation of placement, what I do is suggest that we have an x-ray order, okay? All right. And also, there are some facilities that would require testing for pH, okay? But we don't have that requirement here. So I'm going to go ahead now, and I'm going to remove the syringe. I'm going to place this here on a towel, and now I can do some permanent placement of his tubing here. I'm going to take a piece of tape that I have prepared that is chevron for that reason. Okay, bear with me, Mr. Jones. You doing okay? I know, it's just a little uncomfortable, but we're almost there. This will be helpful. Okay, I'm going to take a third piece and just put across the bridge here. Okay, and so then what I would do is attach this tubing to his gown. I'm going to use a rubber band to do that and clip. And I want to make sure before I have this permanently attached that he can freely move his head. Can you move your head to the left, Mr. Jones? You can? Okay, alrighty. And by the way, this is the right nostril I'm using. I think I may have said left. Alright. So at this point, I would go ahead, and this should be attached to the cheek here. I would go ahead and attach this at a low intermittent setting to the suction. Okay. You doing all right, Mr. Jones? All right, so what I'm going to do is I'm going to leave the call light in case you need me for any reason, and you'll be able to call me for that. Do I need to get you any personal belongings before I leave? You need to go potty? Okay, I'm going to lower you down to a 30-degree. I would lower him down to a 30-degree angle. And is there any other positioning of your legs or anything you want me to help you with? No, you're good? All righty. At this point, I'd gather up all my things to take out of the room, and I'm going to go ahead and document, and I need to document the date that it was an NG insertion, the size of the tubing I used, which was 14-inch, 14 French, 48-inch, the coloring consistency of the contents, and the client's response and any teaching that was done. All right, and I also would come back and every 2 to 3 hours and do dental care for him. Okay, so that would be the completion of the insertion of the NG tube. Now I will come back in 15 minutes and irrigate, okay? 15 to 30 minutes to irrigate. All right, so I'm back in the room. Mr. Jones, I'm back. I want you to just verify first and last name for me, sir. I know it seems redundant, but we just want to make sure that we have the right patient. All righty. And your date of birth? October 1st, 1960. Okay, very good. So it's time to go ahead and do the irrigation for you, Mr. Jones. And these I would have removed. I had no gloves on at that point. Okay, so I'm going to go ahead and wash my hands. I'm going to disconnect my suction tube, my tube from the device back here. Just lay it on the towel. Okay, and I'm going to go ahead and put on my gloves. Doing all right, Mr. Jones? Yeah, I know it's a little uncomfortable, but beneficial. In the long run, you're going to feel better. Okay, so I'm going to check for placement again of the tubing. So I'm going to go ahead and attach my 30 millimeter syringe. Actually, this is a larger syringe, but I'm going to pull out 30 milliliters of content. Okay, I'm noting color and consistency of that content, and I'm going to go ahead again and listen for sound, for swishing sound over the left epigastric area. And simultaneously, I am re-injecting the contents back into his belly. Okay, great. Okay. All right, we do have the swishing sound. So at this point, I'm going to disconnect my syringe. I'm going to draw up. I'm going to draw up 30 milliliters of saline water here. Okay. I am going to inject it into my tubing. And this is the irrigation. Okay, got all of that in. And now I'm going to pull out until I feel some resistance. See how much that we get back. Okay, I feel resistance, so I'm going to stop. Okay, I've gotten 20 milliliters back, so we have a difference of 10 milliliters there. Okay, I'm noting the color and the consistency of this. Alright, so I'm going to go ahead and put this here. And get him covered up there. I'm going to go ahead, I would reattach this to a low intermittent setting, the same setting I had it on before, back here. Okay, how are you feeling, Mr. Jones? You okay? Okay. I would have had him up in the high Fowler's position to do that, and I would lower him back down to a 30-degree angle before I leave him. Need to go to the potty? Again, I'm going to leave you with your call light, okay, so that you can call me if you have any need for me, if you're uncomfortable or I can help you in any way. Do you need me to reposition, raise your legs up or anything? You're good? Okay, great. And no personal belongings? You don't need anything? Okay. Alrighty. So at this point, what I would need to do would be to go ahead and take things out, gather things up that I brought in, and take them with me. And I'm going to go ahead and document all that was done. And so what I did was I inserted, I did irrigation. I did irrigation, so I wanted to say that I inserted the 30 milliliters of saline, and the return was 20 milliliters, giving me a difference of 10. I want to describe the contents that came out and the consistency and the client's response. All right, thank you very much.